Well, welcome back to the Depths of Healthcare podcast. I'm your host, Ben Iiames, here with a great new guest today, member of the team over at IPMD Inc. I wanted to kind of get Scott's thoughts on how healthcare is developing in their realm, and just grateful to have you on the.
Thanks, Ben. I'm Scott Alexander, the Chief Relations Officer with IPMD Incorporated. We're the team behind Echo AI, an emotion detection platform built to read human and microfacial expressions, something legacy platforms like Microsoft and MIT still can't do reliably. We've spent over 100 human hours solving this problem, and now we're launching our MVP this September. Our mission is simple but urgent: bring empathy into digital healthcare, hiring, and the human connection. We're here to reprogram how emotion meets technology. Thank you, Ben.
Cool. Yeah. So, what do you see as what is the big launch in September, and then we'll kind of work our way backwards about what you guys have been kind of built on.
Well, this September, we're launching our Echo AI app, which is more for entertainment at this point in time, but it's just an MVP to give investors an idea of what we're capable of actually doing. It will do just basic stuff at this point in time, but it will be able to interact with users in a way that they can actually communicate with it as it is, and they can choose which avatar they want. They can communicate with it, and it will carry on a meaningful conversation with them based on their emotional reactions in the entire
Mm.
conversation.
And so what you're saying is this app is a development for investors to show the power of the technology of the interface, basically, at this point.
Yes, exactly. It gives an example of the potential that our emotion detection platform is capable of doing. It can obviously do many other things, but this is just a basic example so that people can actually see its potential.
Gotcha. And what about the other kind of two platforms that you guys already have running at this point? Can you kind of share some detail about those?
Yes, we do have the motion detection platforms already set up in the cloud. They can be accessed by a RESTful API for other businesses to utilize in their software or hardware so that their software or hardware can actually have the characteristic of being able to identify the user's emotions that their program is interacting with.
And is this being utilized? I think pretty sure you guys are using this as a telemedicine platform as well.
That is our future business plan. That's what we're actually getting ready to do a lot of crowdfunding for so that we can start working on a telemedicine plan, which would be in the future.
Gotcha. Is that the same? Is there also the future plan for the kind of third category that I was noting throughout your business of hiring portal assistance?
Yes, for an interview platform that for companies that do video interviewing of job seekers. So yeah, so it would make it easier for HR companies as well as hiring managers to know how a job seeker will react in certain situations. It'll give them more information just on how they actually act when they put them in certain situations.
Mm-hmm. Mm-hmm. Wow, that could be very valuable.
Yeah, 'cause, if you want to have somebody that's gonna talk to a lot of customers and such, they are gonna need you're gonna wanna hire someone that has a lot of confidence and that, doesn't have difficulty speaking to people that they do not know.
Mm-hmm. Mm-hmm. And describe as best you can, Scott, just kind of the realm of healthcare that you guys want to help solve, and what this all stemmed from for your company, and um, what it grew out of, and what you guys have a vision for in the future.
Well, in, 2016, one of our colleagues, Shu King Zong, she committed suicide, and this was just come out of nowhere. We had no idea that she was even sad or depressed. We asked, what could we do to be more aware of someone's emotions before something tragic like that was to happen again? And that led us down this path of creating an emotion detection platform. Um, the big goal at the beginning was to actually decrease the increasing suicide rate. If there is some way that we can stop people before they actually try to commit suicide, we're be more likely to actually save lives. And if we can save one life, we'll save thousands of lives.
Hmm. Yeah, that's a really um, tragic story. Um, Again, the reason I do this podcast, and for our listeners, you're very aware of this, but it shows that there is hope in humanity, that people are actually trying to do good things for other people.
Yes, thank you. It's for myself, it's very important. I've lost a few friends in the past to suicide. On the 4th of July, I lost one. He was a
Mm,
veteran, and yeah, he took his life, and it's still a little raw.
mm, yeah, I'm sorry about that, man. That definitely, we've all had. I feel like many people nowadays have had more than a few people close to them in similar situations. So really sorry about that. What are your dreams and your goals for the vision of the company, of obviously where to go? Obviously you have the two telemedicine and the hiring or interview portal kind of applications that you're working towards eventually. But what are the goals in this next, 6 to 12 months, 5 year plan? I don't know your timing, but what, how do you guys see this rolling out?
Well, in the next 6 to 12 months, we hope to raise the money we need to start working on our business models that you mentioned, also to improve our downloadable app so it's even more capable of carrying on a meaningful conversation with the user. Furthermore, that would should be able to we should be able to do within 6 to 12 months. Enough money brought in, we can start on the telemedicine platform, which that one will take a while. We have to go through FDA's Class 1 CDSS registration as a software as a medical device, and that will take some time. And then once we have that registration, we can actually file for a CPT coding to be able to bill insurance companies.
Yep. Yep. And at that point, would you sell the telemedicine platform as a product to private clinics and health organizations?
It will be offered as offered free, but the billing will be for reports and as well as the meetings themselves will be billed to the insurance company. The doctor and the patient will not have to pay anything out of pocket. It'll go straight to billing the medical company, the insurance companies. And that
Insurance
at least
companies.
have to start. The purpose of doing that is so that when we bring out our telemedicine platform, doctors will be more willing to use it because they're not gonna have to pay anything for it, and their patients won't have to pay to use it as well. And
Hmm.
that'll make it a lot more attractive to them.
Yep. Yep. And that was my next question. It was, um, small primary care clinic who has maybe let's call it a 40% telemedicine visits versus and 60% in-person visits. If they would like, but they only have three clinics, how do you approach them and kind of market your product to them and market that platform?
Yes. Yeah, I have to make it to if they know that it can help improve the data that they get so that they can have better diagnosis of their patients and better outcomes because they have better diagnosis and it doesn't cost them anything. It
Mm,
just because the insurance is getting billed for it, we believe they'll be more likely to jump on board on this. And all we want to do is improve their ability to do their job.
totally. Are you guys going to help with charting and everything, or is it mostly just that emotional AI integration that you're
We
helping with?
haven't actually got into exactly what the telemedicine platform is gonna look like yet.
Okay.
We're not experts in that yet. So one of the things that we will do when the money comes in is to talk to the experts and get a good idea of what we really need to put in it along with the emotion detection platform.
Right, right. And so the next steps for you guys are a big crowdfunding campaign, is what I'm understanding.
Yes, that's
Yeah.
gonna be starting in September. That's our next step.
Yeah. So app release, show investors that you have an amazing product, and then hopefully everything trickles from that.
Yeah. Okay. That's the plan.
That's the plan. Yeah, it seems like it's been a lot of heavy lifting up front, though, to be honest. Like you guys have really worked really hard to get to this point. Is that right?
Yes. Yeah. It's been very time consuming as well as CPU consuming. We spent over 130,000 hours, human hours, just collecting data, getting the pictures and fine tuning them and getting them labeled properly just so we can train our models. And our
Mm-hmm.
models have finally actually are 96% ROC over AEC score, and this is because we've spent so much time and worked really hard to make sure that it was being trained accurately.
Yeah, and that's the big key is for the AI. And correct me if I'm wrong on this, but for the AI to learn and to and to integrate better, it needs more experience to learn from. Is that correct?
For future, yes. I mean, right now you know, we've collected so many, over 500,000 pictures that we have used to train it with. So it's fairly accurate. Like it's got 96% ROC over AUC score. But in the future, yes, to continue improving that score, which, is gonna take just pretty much have to double our data that we have now,
How are you
just
guys
to improve
approaching
it
that
1%.
of doubling the data?
We're still collecting data and training, but yeah, it seems like it'd be a lot easier once we actually have a large investment come in so that we could actually improve, because that's part of the investment that the money that we're asking for is going to be used for collecting more data, a high amount of it, like I said, because we need to double it. It's taken several years just to get to what we have already.
Sure,
So once we
sure.
have income, the investments put in place, then we could actually outsource and get the data in quicker so that then we can then make sure that it's fine tuned and labeled appropriately before we start training the model some more.
Right, right. That totally makes sense. More out of curiosity, other than obviously income, every startup has troubles with funding. But what are some of the technical kind of roadblocks you guys are mostly running into? Is it marketing stuff? Is it sales? Is it the technical side? What kind of are your biggest roadblocks as a company as a whole?
In the past, our biggest roadblock was our training data. Like I said, if humans are faking their emotions or suppressing them, it's difficult to label the emotions accurately. We had to build our own data set from micro expressions, and it took 6 years for us just to get to over 130,000 human hours. Presently, our biggest roadblock is our development team is mostly interns from colleges. They're brilliant, but right now they're juniors. They're not experts really. So we're using a lot of generative AI to speed up content, create pitch decks and graphics. We're also right now we're having to do a lot of studying for the best crowdfunding models to maximize our campaign successes. And we see that
Totally.
in the future, some of our pain points is obviously going to be our regulatory navigation. To bring the telemedicine platform to the market, we're going to, like I said, we'll have to have a FDA Class 1 CDSS, software as a medical device registration. And then from that point, we'll be able to get a billable CPT code. And that there will take about 12 to 18 months of compliance work because we're dealing with the government.
Things usually don't move quickly.
No, 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 they
No,
don't,
not when it
especially
comes
if
to
you're
the
talking about the
government.
government.
Yeah. Yeah. And man, really cool. I think kind of like what you guys are building towards, I think integration of this has a really big opportunity in our world today because even with the technology levels increasing and, AI becoming more part of businesses and learning very efficiently, the human population is getting more and more anxious and depressed at the same time. And it seems like you guys are just doing a world of good or attempting to do a world of good to kind of break into that and address that. In summary, it just feels like The point of our show is bringing to light kind of people and companies that are kind of working for the better good and showing that there are good people out there trying to build a better system rather than what we have. Do you have any other kind of closing thoughts or summary of kind of obviously where your company is now, where you dream of being, and maybe even personal kind of insights into the Medicare or medical world?
Well, at IPMD, we believe that the next leap in AI isn't about just intelligence, it's about emotional understanding. Whether you're a doctor treating patients, an employer hiring talent, or just a human trying to be seen, we're building Echo AI just for you. We're inviting early supporters to join our crowdfunding launch. And this fall in September, we'll be starting that and help us bring empathy into our everyday screen we touch.
Yeah. And for our listeners, I'll have a link posted so that if you are interested in becoming a part of the crowdfunding, you can absolutely contact IPMD. So I'll make sure to include that. And Scott, thanks for your time, man. I really appreciate all your insights and all the good you're bringing to the world.
Thank you for your time, and I appreciate you having me on here. Really
Absolutely.
appreciate it.
Yeah.
Thank
You have
you.
a good one. Okay.
You too. Talk to you later.